Hello friends. Now I'll be talking to you about spondyloarthrosis. It is a group of diseases which include ankylosing spondylitis, Retter's disease, it also includes juvenile rheumatoid arthritis, psoriatic arthritis, and arthritis occurring in inflammatory bowel disease. Now, what are the features which are common to this group of the diseases? The features common are, first of all, they are seronegative. That means RA factor or rheumatoid factor is negative in these patients. Second, they are HLA-B27 positive. Third, usually the earliest and the most common joint involved is sacroiliac joint. That's why the most common symptom is low backache. Low backache is a very important feature in this thing. Okay? What else? Then in this, you get enthesopathy. What do you mean by enthesopathy? Point of attachment of tendon to bone is painful. So this enthesopathy is a very important feature of spondyloarthrosis. Then anterior uveitis is a very important feature. Then the patient may have aortic regurgitation, especially in case of ankylosing spondylitis. Right? So after that, now I'll be talking to you about ankylosing spondylitis. What are the extra things that we see in these patients of ankylosing spondylitis? These are usually middle-aged males, and the most common presenting symptom is low backache, which I told you is due to sacroiliitis. And later on, this is the vertebra, and these are the intervertebral ligaments. These ligaments get calcified. So as the ligament get calcified, that reduces spinal motility. So reduce spinal motility. And this reduced motility we check by Schober test. And as the spine is calcified, and if you take X-ray of the spine, what we get? Classical repeatedly asked question, bamboo spine. This is a very frequently asked question. All are questions. So you get bamboo spine on X-ray of the spine. And later on, the calcification of the costochondritis of the junction also occur. So that lead to rib cage totally calcified rib cage, and there is lung fibrosis that lead to interstitial lung disease. So due to rib cage calcification and lung fibrosis, it lead to restrictive lung disease. And respiratory failure is one of the important causes of death in these patients. Investigation. Best initial test X-ray of sacroiliac joint. Okay, that space is reduced, narrowing of the space. But best, most confirmatory test is MRI. These two are really specific. MRI is the most specific to diagnose a case of ankylosing spondylitis. Now, how to treat a case? For acute pains, NSAIDs are always first to be given, and the most effective NSAID is indomethacin. Then, other than the physiotherapy, the other drugs what we can use are TNF, alpha neutralizing drug like infliximab, etanercept, okay. So any of the TNF alpha neutralizing drug we can use. Now there are certain new drugs have come up. The new drugs which can be used in the drug are, this is ustekinumab, and secukinumab. So they are the new drugs which have been used for treatment of ankylosing spondylitis. Now, what are the complications which can occur in this patient? First is respiratory failure, or recurrent chest infections, aortic regurgitation is a big problem in this patient. Of course, there can be MR can be there, and in this patient, as the spine is very rigid, the fracture of spine is again a contributor to mortality of these patients. This is all about spondyloarthrosis. If you have any comment or suggestion, you can very well contact me on the messenger. You can join our forum by sending your details so that we can communicate more to each other. Thank you very much.